Hello everyone, this is Dr. Abhinav, and in this video today I'll be talking about UPSC CMS personal interview. So basically I'll be talking about the etiquettes that is needed to be followed and the dress code to wear, marks allotment, all those kind of basic things I'll be talking in this video. So as you all know, first you'll have to give the UPSC CMS written exam. Then after that you will be selected for the personal interview, and then you will attend the personal interview at Delhi. So before going for the personal interview, we'll also fill the detailed application form, which I think you know already. So the personal interview will be conducted at Delhi, UPSC Bhavan. For the personal interview, basically it's 100 marks. So out of 100 marks, even if you don't answer any questions, you will be allotted at least 40 to 50 marks. That is because of your etiquettes, which I'll be discussing right now, and those kind of things that you will need to follow. So once you go to Delhi, first in the UPSC loan, you'll deposit your baggages, and then you will be waiting in the another room where your documents will be checked, and then you will be called for the interview in another room. So to start with, what kind of dress to wear for guys and for girls? So for guys, it's best to wear any formal dress. It should be looking decent, and wearing a blazer or coat additionally it's completely up to you. You can wear that also, but I would like you to avoid wearing studs or any wristbands, those kind of things. So try to look as decent as possible. For women, anything formal is fine, or wearing a sari is also good. So you can decide upon it. And then once you're called for the interview, you will go to the interview room, and don't just go in inside. Just first knock the door, ask permission if you can enter the room. Once they say yes, then you will go inside, and then you will be given a table and a chair. So you will go inside and do not sit in the sit in the chair directly. Just stand near the chair and wait for them to ask you to sit. So once they ask you to sit, you will be seated, and you will also greet good morning, good evening, everything. And then you'll be having a file with you. So don't keep that file on the table, just keep it over your lap. And if they ask you to keep, then you can keep it on the table. So when you sit properly. Don't shake your legs or hands. Don't break your knuckles. Just don't be tensed. Just you'll have to believe in yourself that you will know everything. So even if you don't answer anything, uh, because of your etiquettes, usually they provide marks. So do not worry. Actually, you would have you can easily clear the interview. And mostly make sure you give them a very good impression of yours. So you are seated properly, and then there will be 4 members or 5 members in the panel. So in the center will be an IAS officer, and in the sides medicine and surgery, Obgyn and PSM. So in the center, IAS officer will start the interview. Just we'll start with the basic questions like your name and those kind of things, which I have covered already in a separate video. The expected questions from IAS officer, you can go to my channel and uh, take a look on that video also, or just check in the description. I will tag that video. And then after that, you will be asked questions from medicine, surgery, OB/GYN, PSM. Everyone will ask you questions. So when you answer the questions, make sure you answer it in a sequential manner. For example, from medicine, you are being asked the question to discuss about a topic. Then you will start with etiology, clinical features, diagnostic, treatment in that order. Don't go to treatment first, then come to clinical features, then jump to diagnostics. Don't jumble those kind of things. most probably you will be asked about clinical based questions. Sometimes other questions also can be asked. So if you know the answer, answer it confidently, and your confidence should be seen in your face. But if you don't know the answer, don't just make up stories. Just tell them that, sorry, sir, I'll learn it next time, or I'll learn it after the interview, and they will be pleased with it also. And then they will ask you other questions, and so you can answer those questions. So be honest with them. Don't try to make up things. So answer honestly. And the interview will be taking place for 25-30 minutes, good amount. And it won't be kind of very serious kind of interview. So they will also talk well. So no need to worry about anything. You'll just have to be confident and give your best. Okay. Because remember that this interview mark can boost your final cutoff. You would have already got good mark, or if you are a student who has done your written exam in a kind of average manner, then use this interview in order to boost up your final marks, and can also get placed in a good place. So after your interview is done, then just say thank you, and then slowly get up and get out of the room. So go out of the room, close the door, and that's all. Your interview will be completed. So the important thing is that you will have to give them a good impression. They should believe in you that you know everything and you can manage a patient. So you can. They will also ask about your experience in the internship and the cases seen. So you can tell about your experience also. So the interview will be going on quite good only. So do not be scared or worry. You can do it actually. So that's all I wanted to say about this interview. And if you want, I can make questions on separate subjects, the expected questions for separate subjects, and you can see that also. So if you haven't subscribed to the channel, please do subscribe. Thank you.